Starting. All attendees are in listen-only mode.
Good morning, good afternoon. I'm David Wallinga, Director of Healthy Food Action. Welcome to the third in our four-part Meat Matters webinar series on the intersections of meat, livestock production, and public health. I want to thank our series co-sponsors, the Johns Hopkins Center for a Livable Future and the Alliance of Nurses for a Healthy Environment, along with Healthy Food Action. Healthy Food Action is a national network created to unite health professionals across our disciplines so that we can advocate for the kind of food and farm policies we all want, policies that help create food systems that are healthier, more just, and more sustainable. Making sure the webinar runs smoothly today is Rachel Gruel, my colleague. We have three prominent speakers today. Our lead speaker is Dr. Walt Willett. Dr. Willett's known to many as the author of best-selling books on nutrition like Eat, Drink, and Be Healthy. But in fact, he's the most quoted nutrition authority in the world. We're honored to have him. Dr. Willett's also professor of epidemiology and nutrition and chair of nutrition at Harvard School of Public Health and a professor in the medical school as well. In his career, he's been at the forefront of developing methods for assessing health consequences of the choices in our diets, including around meat, and then putting together huge cohorts of Americans on which to apply those methods. Our other two speakers are prominent in their own right. From Johns Hopkins, we have Roni Neff, an assistant professor there, as well as director of the Food Systems Sustainability Program within the Center for a Livable Future, our co-sponsor. Dr. Neff also just published an edited textbook called Introduction to the U.S. Food System, Public Health, Environment, and Equity. Her PhD in Environmental Health Sciences is from Hopkins as well, and she has degrees from Harvard and from Brown University. Coming last is Dr. Hugh Joseph, who has master's and PhD degrees from nutrition from Tufts University, where he's an adjunct faculty member in the Agriculture, Food, and Environment program of the Friedman School of Nutrition Science and Policy. He also teaches graduate students there in food systems and community food planning. Dr. Joseph's work has always had a community focus, whether it's his emerging initiative on sustainable diets or the numerous networks that he has co-founded, like the Community Food Security Coalition and the New England Sustainable Agriculture Working Group. Judging from these speakers, I think you'd have to conclude that Boston's one of the country's great incubators of thinking around diet and food systems. After our speakers, we hope to have about 20 minutes for a question and answer period. So don't wait to submit questions. Earlier is actually better. Look for the box on the right-hand menu of your screen that says enter your question. Just type it in and then hit send. And now I'm looking forward, as I'm sure you are, to Dr. Willett's presentation. Dr. Willett?
Yes, thank you, David, for that introduction. I'm going to take a few minutes here and take a quick tour over what we've learned about red meat and meat in general in the diet and long-term human health and well-being. Next. This area of research was largely an outgrowth of what we call ecological studies that were done in the 1960s, 1970s. This means comparing cancer rates or rates of heart disease and other outcomes across countries and looking at their correlations with various aspects of diet. One example was a major analysis of cancer rates done by Armstrong and Dahl in 1975. And here, for example, they showed that there was a very strong correlation between meat consumption, mainly red meat at that time, on a per capita basis, and colon cancer rates if you looked around the world. Down in the lower left, you can see traditional Asian societies in developing countries, and then the U.S. and New Zealand and the affluent Western countries were up in the right side. Now, one possible explanation could have been genetics, but other epidemiologists were looking at populations who migrated from, for example, from Japan to the United States. And what they saw was that after just several decades, the rates in those migrating populations caught up with the European Americans living in the United States, and in fact seemed to be going a little bit higher even than the European Americans. And that really showed that there were this very large difference in rate was not due to genetic factors. It was something about the diet and the environment, and there was a clue that it was meat. But the limitation of this kind of study is that there were many other aspects of diet and lifestyle and environment that were different among these different countries, and so you couldn't specifically be sure that this was a causal relationship between meat and colon cancer risk. Next slide, please. Other epidemiologists, Ansel Keys notably, were comparing cardiovascular disease rates around the world. And again, they found huge differences, more than tenfold, from here East Finland at the highest rate down to Crete at the lowest rate. And again, migrants going from low-risk areas to high-risk areas changed their disease rates and became equal, very similar to the rates of other populations already living, for example, in the United States. Here they didn't look specifically at meat, but looked at saturated fat intake, which at that time the major source of saturated fat was from red meat in the diet. And there was this very strong correlation, but again, the major limitation was potential confounding by other aspects of diet and lifestyle. Next, please. So to look, next slide, please. To look at this in more detail, we set up several large prospective studies, as David had already mentioned. And the first was a nurses' health study that included about 121,000 women across the United States, and then 52,000 men in the health professionals follow-up study. And then nurses' health study 2, which enrolled younger women, because we were realizing at that time that many of the factors that influence breast cancer were operating in childhood and early adult life. So this is what we call a prospective cohort study, and there are now several dozen around the world. But here we have much more detailed information on individual diets and also their other behaviors like smoking and physical activity and medical history, family history. And so we can look in much more detail at different aspects of the diet and can control statistically for potential confounding variables like smoking or physical activity. And I mentioned some of my co-authors here at the bottom. These are obviously very complex, large studies involving hundreds of thousands of people. Next, please. When we first looked at red meat and cancer, we were looking at colorectal cancer because of the earlier report showing large correlations or strong correlations looking across countries, and we did see that red meat intake was associated with higher risk of colorectal cancer, even when we adjusted for other risk factors for colorectal cancer. And when we dug down a little bit more deeply, it was to a large extent coming from processed red meat, but we did see that fresh red meat as well was also associated with higher risk of colorectal cancer. Next. This was one study, of course, but as I mentioned, other cohort studies have been started along the way. And this is a summary of what we call a meta-analysis that was conducted by the World Cancer Research Fund and American Institute for Cancer Research. This was a review published in 2007. And as you can see, every study that looked at this was either showing no association, and there was just one, or positive associations. If we look at that vertical line in the middle of the slide, that means a relative risk of 1. So if you're above the line, there's a positive association. And if you look below the line, there's an inverse association. There's not a single study that showed an inverse association. And essentially all of them were in the positive direction, adding support for the relationship between red meat consumption and colorectal cancer. Next slide, please. A more formal statistical summary of the data was published by other colleagues, Drs. Norat and others. And this is what they found in their statistical summary of the published studies, basically looking at for an increase of 120 grams a day of red meat, that's a little less than 4 ounces. There was a relative risk of 1.24, meaning a 24% increase in risk of colorectal cancer. And when they look specifically at processed meat, for just a 30-gram day increase, there was about a 36% increase in risk of colorectal cancer. Next slide, please. This is looking in the Nurses' Health Study, again, at coronary heart disease, CHD for short. This is based on 26 years of follow-up that we published about 4 years ago. And in this analysis, we had several thousand women who had developed coronary heart disease, meaning a heart attack or death from coronary heart disease. And as you can see, there's a fairly weak but clearly significant, statistically significant positive association. And the women consuming the highest amounts of red meat per day, which was about 2 servings of red meat per day, had about a 20 or 25% higher risk of a heart attack compared to those who consume the lowest amount of red meat in the diet. This is clearly an increase in risk you'd rather not have, but it's a modest increase in risk. However, this is a standard way of looking at the data, but what became apparent to us was that when you were looking at red meat and adjusting for total calories in the diet, you're really comparing red meat with everything else in the diet. And when we look at what else is in the American diet, it's mostly not such a good source of calories. It's mostly refined starch and sugar, partially hydrogenated vegetable fats. So the comparison here is really a lot of unhealthy calories. And what this is saying, that red meat is even worse than what is mostly a pretty unhealthy mix of calories. Next slide. So we went on to conduct some more detailed analyses comparing different protein sources. So this is looking statistically at 1 serving a day of another protein source replacing red meat. And for example, here you see that looking at poultry for red meat, the bar goes to the left of a relative risk of 1, meaning there's a relative risk of 0.8 or about a 20% reduction in risk of coronary heart disease, replacing 1 serving of red meat with 1 serving of poultry. And it really didn't matter what protein it was, using that to substitute for red meat was related to lower risk. Fish, particularly nuts, were very strongly related to lower risk if they replaced red meat. And beans were also related to lower risk. However, you see the error bar around beans means that there was a lot of uncertainty about that, basically because not very many people were consuming a lot of beans in the diet. Next slide, please. We've also gone on to look at risk of type 2 diabetes, a really major epidemic in the United States and much of the world. And we did see a clear increase in consumption of total red meat, total meat, which that would include poultry and fish as well as red meat. And the different columns here are the different studies: Nurses' Health Study, Nurses' Health Study 2, and Health Professionals Follow-Up Study, are 3 large cohorts. And as you can see, there's, for 1 serving a day increase in total meat, there's about a 19% increase in Nurses' Health Study 2, 11% increase in Nurses' Health Study 2 and Health Professionals Follow-Up Study. And then there's essentially the average in the right-hand column. So all types of meat, but especially fresh red meat, and even more so processed red meat, were related to higher risk of type 2 diabetes. And for total red meat, as you can see down in the lower right-hand corner, about a 14% increase in risk of type 2 diabetes for each additional serving a day of red meat. Next slide. We again went on to look at a substitution analysis, and as you can see here, the type of protein in the diet made a large difference. For, one serving a day, swapping nuts for red meat was was associated with quite a reduction, about a 25% reduction in risk of type 2 diabetes. Low-fat dairy was related to lower risk of diabetes, whole grains for red meat, poultry for red meat, and to a somewhat lesser extent fish for red meat. All of these were related to lower risk if we made this substitution. Next slide, please. More recently, we went on to look in the Nurses' Health Study 2 at dietary factors and major protein sources in relation to risk of premenopausal breast cancer. And as I mentioned at the beginning, this study was designed to look at diets earlier in life. We had not really seen much relationship between meat consumption of any type and breast cancer risk when we looked at midlife diet or diet later in life in relation to breast cancer. And almost every other study had started off looking at diets in midlife and later because that's when people were developing cancer and heart disease. So this is quite different study. And what we found was, looking in Nurses' Health Study 2 at early adult diet, red meat consumption was related to higher risk of premenopausal breast cancer, about a 40 or 50% higher risk of this cancer with higher consumption of red meat. Next slide, please. And in the substitution analysis, again, as you'll see here, if we looked at legumes, nuts, or poultry, there was lower risk of premenopausal breast cancer, replacing those foods for consumption of red meat. And then since nobody's going to eat just nuts or just legumes, we looked at the whole combination of legumes, nuts, poultry, and fish, any one of those or a mix of those replacing red meat. And there was about a 25% lower risk for each serving a day substitution. Next slide. And in this analysis, we've gone on to look at diet earlier during adolescence and found about again, about a 50%, 40 or 50% higher risk of red meat consumed during adolescence and risk of breast cancer. Next, please. And then to wind up here, we've looked at total mortality in relation to red meat consumption. And here, this is a health professionals follow-up study on the top. And as you can see, the dark line there is looking at increasing number of servings per day of total red meat in the diet. And with about 3 servings a day, there's about a 50% increase in risk of total mortality, and very similar findings in the Nurses' Health Study if you compare that to people who consume very little red meat in the diet. So this is a very strong association when you're looking at total mortality. Next slide, please. And similar substitution analysis, the bar, the vertical line is at the right-hand side of that slide, the relative risk of 1. So you can, again, as you might expect from everything I've showed you so far, swapping out red meat and replacing it with either nuts or legumes or low-fat dairy or whole grains or poultry or fish, there was a reduction in risk of total mortality. But nuts look especially good. Next slide, please. And finally, the National Cancer Institute has been conducting a very large prospective study. This includes about 500,000 men and women, and they published several years ago a similar analysis looking at total mortality. And as you can see here, there's a very clear increasing risk of death, up to about almost 40% increase in risk of total mortality with the highest amount of red meat in the diet. This is specifically looking in med, and if we could have the next slide, please. This is looking at in the same cohort at red meat consumption in relation to total mortality in women, and we find virtually identical findings. So looking at across many different endpoints, including total mortality, it's really quite clear that red meat is associated with many adverse outcomes. And for long-term health and well-being, we would be better off consuming less red meat. One of the obvious questions is how much red meat should we really be consuming? And it's pretty hard to say a specific amount because, as you can see here, there seems to be a pretty linear relationship there's no clear cutoff where there's a safe amount of red meat consumption as far as we can see. So from looking at the available data, it would appear to be as little as possible. And I think for optimal health, that probably is the right answer. For example, in the traditional Mediterranean diet, which we've seen to be among the healthiest dietary patterns, red meat was present. People were not vegetarians, but it was really something that people had on special events for Easter, for Christmas, maybe a couple other times per year, but it wasn't an everyday food. And I think from a health standpoint, that is indeed what we're seeing showing up in our studies as well. And one good, I think, conclusion is that there are many alternatives if we want to cut out or greatly reduce red meat consumption in our diet. Plant sources of protein look to be probably about the healthiest, but poultry and fish actually look pretty good as well if consumed in moderation. So thanks for joining us, and I'll turn it over back to David.
Give me a second here to load up the next set of slides. And then we'll hear from Dr. Roni Neff. Okay, take it away, Roni.
Hello, everyone, and thank you for the opportunity to present to David and to Healthy Food Action. So the title of my talk is Sustainable Dietary Guidelines, Why Meat? And I'm going to start out by talking about the why meat in terms of sustainability, and then I'm going to turn back to the concept of dietary guidelines and bringing sustainability into it. And next slide, please. So you've heard a pretty good argument for the health effects of consuming meat, and at this point, you'll hear that the environmental message is also very strong. So when I say sustainability, there's a lot of different meanings that word could have, and the basic meaning that I'm using here is just the ability to continue indefinitely. And there's environmental, economic, and social sustainability. All are important, but in the context of the dietary guidelines, we're primarily focused on the environmental angles. Next slide. So when it comes to meat, there are many reasons why, and there's extensive evidence on all of these. I'm not going to show you specific data on each of these because I would take a lot more than my allotted time, but that meat is damaging and reducing our limited resources in terms of land, energy, water, and phosphorus. Next. It is contributing disproportionately to other foods and to other products in terms of climate change and other ecologic threats, and that would include biodiversity and nitrogen cycles. Antibiotic use in food animal production is not sustainable. Next. The way that we produce meat and the types of systems that are going on pose significant equity challenges in terms of the workers and the producers and the communities living nearby. And finally, the extent of meat that we are eating could be said to pose a significant threat to our overall long-term food security. Now, when it comes to meat, part of the reason for this is that there's this basic core inefficiency. So we have to first produce the feed and then feed it to the animal. And some of that is metabolized and goes into waste, which then poses its own ecological problems. And then only some of that feed turns into the meat that we're going to eat. And a significant portion of the animal is not eaten. So there's a big amount of inefficiency there. And so you can see, for example, in just making a quarter-pound hamburger, it takes 6.7 pounds of feed, 52 gallons of drinking water, 75 square feet of land, and over 1,000 BTUs of fossil fuel energy. And that's just for one quarter-pounder. Next. Next. And in terms of greenhouse gas emissions as well, the impacts are quite disproportionate compared to other foods. And so you can see here, for example, in this study, red meat accounted for 30% of greenhouse gas emissions from all the food that we eat in this country. A very recent study came out and said 35%, and that's considering that the red meat was only about 4% of the diet. And if you add in the other animal proteins, you get 58% of our greenhouse gas emissions coming from food. So you're seeing a common theme here that it's not just meat, both in terms of health and environment. It's the red meat in particular that's posing a lot of the problems. Next slide. Next slide, please. So at this point, I want to change gears and turn to the dietary guidelines for Americans. So this is, you've probably seen My Plate. That's the most recent dietary guidelines. And they come out every 5 years. And the way that it's developed is there's first a committee of external experts. I believe Dr. Willett was on that in previous times. And they come together and review the evidence very closely and make a set of recommendations, which USDA then takes and turns into dietary guidelines. And there's a fair amount of politics at that point that goes into it. And what does it actually say about meat consumption? Well, in terms of the, so traditionally it's only been just looking at nutrition. And they've actually made some statements that would be in line with a lot of what we would recommend from a sustainability standpoint. Choose a variety of protein foods, and then it lists a lot of them, which include a lot of vegetable proteins. Replace protein foods higher in solid fats with choices lower in solid fats, which is code, of course, for red meat, although they didn't come out and say it directly. And next. But then you might wonder, well, how much are we being told to eat? And for that, you'd have to dig all the way down. And if you go to page 51, buried in there, there's a chart. And here's a selection of it. And it's basically saying, so we're eating 2.5 ounces a day of red meat if we were all eating a 2,000-calorie diet, and that we should be eating 1.8 ounces. So it's actually a pretty significant cut that they're recommending, but it's buried and it's hard to see. And part of the argument that we're making is that bringing the sustainability issues into this communication can support some people's motivation to further reduce their meat consumption. Next slide, please. So the concept of sustainable dietary guidelines, I believe, got its start in 1986 when Joan D'Augusto and Kate Clancy wrote a paper promoting this idea. And since then, a handful of other countries have brought sustainability into their dietary guidelines, but it's never even been on the table in the United States. Next. So this time around, however, as the dietary guidelines process has gone forward, this is the very first time that we've ever had this opportunity. And the advisory committee developed one of its 5 subcommittees to focus on food sustainability. And the rationale for this, which I believe is the right rationale, is that if our government is making recommendations to us about what we eat, they should be thinking not just in terms of short-term nutrition, but the population's long-term ability to get good nutrition. And therefore, we have to think of future food security, and that would include sustainability. Next. That said, it's very political, and so the House Agricultural Appropriations Committee actually came out with a statement for essentially forbidding USDA from including sustainability in the 2015 Dietary Guidelines for Americans. Next slide. So it may be challenging this time around to get sustainability in there, although it's not. It's still entirely possible. But let's say the Dietary Guidelines Advisory Committee comes out with their review of the evidence, and they might make recommendations related to sustainability. Or let's say we take it outside of the governmental guidelines and just say, well, what should guidance or recommendations about how to eat sustainably? What should it say about protein? And so these are my thoughts about that. First, we want to lead with the positive. It tastes great, it costs less, and it's convenient. You can do this conveniently. Second, we really need to educate about the sustainability impacts, and there's a tremendous lack of knowledge across the population. There was a survey that even came out just yesterday further demonstrating this, about these environmental impacts of meat and dairy. And then the third thing is that people need a lot more guidance in terms of how to do these plant-based diets. And so, first of all, the messages and the information should be more prominent. In the brand new Brazilian dietary guidelines, they actually asked the population to come out and send them photographs of their meals that match the guidelines, and I love that idea. We need to emphasize the health message, of course, because those messages go in tandem. We need to let people know that they don't have to worry about not getting enough protein if they eat less meat. And then there's a real need for research on what's the most effective framing. Is it plant-based diet? Is it eat less meat, lower on the food chain? There's a lot of different ways that this could be framed, and so there's a need for research there. And there's a need to segment audiences to reach those depending on where they are in terms of the spectrum of eating less meat. We've got about a quarter of the population who says they are not planning to eat less meat and they have no interest in it. But we've also got about a third of the population saying they're already in the process of trying to eat less meat. So that's an opportunity. Next slide. So finally, I want to wrap up with this question of, is the concept of sustainable diets too individual or too paternalistic? Should we just be focusing on changing the system and not telling people what to eat? And I would say in terms of paternalism, it's really important to be very careful with this because what people eat is very sensitive to them. And so we have to be careful not to be preachy or judgmental, just convey the information and just try and build motivation. But that said, the demand side is critical for driving supply. And there was a study that came out recently that found, for example, that changing our diets to meet the meat recommendations and dietary guidelines would give 1.4 times the amount of reduction of greenhouse gas emissions by 2050 compared to if we did sustainable intensification across the entire food supply, meat supply chain. So diet really matters, and what we demand drives supply. And then, of course, consumers have little awareness. Second, bringing people in through diet is a way for people to engage, and once people start changing their diet, they've established their intentionality. That could lead to support for other action. Next. And finally, this is not only about the individual level. So what goes into the dietary guidelines can have great reach, both in terms of the nutritional advice that's given all across the country and the fact that what goes into the dietary guidelines also shapes federal food programs. And what goes into recommendations about eating sustainability can often drive institutional purchasing. And you think of how much food a lot of these institutions, like a hospital or university, purchase, shifts in their purchasing can make a big difference on an entire food system. So in conclusion, there's tremendous value in developing and communicating about sustainability in the dietary guidelines. And it's important, despite the political challenges, to include meat. Thank you.
And now we're going to hear from Dr. Hugh Joseph.
Good afternoon, everybody. Are you going to load the slides? Okay, this is where we start. My name is Hugh Joseph from the Friedman School at Tufts University in Boston. And I'm going to build some additional dimensions on the issues of whether or how much meat we should or shouldn't be eating and try to put public health into more of an ecological and sustainability context as I pose those questions. So we start here with the fact that it's a meat world, but where do we go from there? Next. And the primary question is, in terms of eating a healthy diet, it depends on how one defines health. The dietary guidelines, which Roni was just reviewing, say that they are designed to promote health and reduce risk of major chronic diseases. But they do not define health per se. And furthermore, they don't really focus on notions of public health nutrition beyond the narrower approach to healthy diets. In other words, the diet disease framework and evidence that's there for it, as Dr. Willett more than ably reviewed. Next. An ecological focus to public health, or an ecosystem approach, as some call it, would integrate social, ecological, and cultural and other dimensions into the health or public health framework, and not just the personal health approach. Now, absent in much of the diet-related policymaking is this broader ecological context, and it's not just in the dietary guidelines. In other words, we've been acting as if habitat is somewhat irrelevant to our choices for food and to a healthy lifestyle at all. Next. And yet, as we know, as we grow up, this is not what we learn. If you look at the names of these books, and there are thousands like them, these stories teach children about the creatures in the world and how they're dependent on their surroundings to thrive and to survive. And it's similar to a fish tank. Next. Most of us have grown up or maybe still have an aquarium at home. And when we have an aquarium, we learn as children and as adults that we don't just have to put in a good amount of fish food. We have to look after the aquarium. We have to make sure the water's clean and at the right temperature. We have to make sure the fish balance with the plants. We have to aerate it. We have to clean out the waste and so on. So this is an aquarium is sort of a habitat in microcosm of what the world is like. Next. And then our policy frameworks focus primarily on feeding the fish and ignoring the integrity of the aquarium. I really find this really curious because if we're going to deal with sustainability, it calls for inclusion of a resilient planetary environment into the whole health promotion disease equation, disease prevention equation, and not just this singular, what am I supposed to eat for dinner tonight? Next. Okay, so sustainable diets from a public health perspective. What I'm doing here in a somewhat linear fashion is starting at the top with people on the planet. And if we have global sustainability built, it's out of that global sustainability framework that sustainable food supplies can emerge. Out of a sustainable food supply, we can get sustainable foods and healthy food access, and that produces sustainable, i.e. healthy diets. And out of a sustainable diet emerges ecological health for people on the planet. So it's a circular loop. Next. Here is an example of a sustainable diet with some of those dynamics in it. There are many, but meeting your nutrient needs, addressing cultural issues, seasonal foods, equity, fair trade, biodiversity, environment, climate are examples of that. Next. But we don't see that a lot. Now, what I want to talk about in the next 3 or 4 slides are some other elements of sustainability that don't get a lot of attention. One of them is biodiversity, arguably one of the most important elements besides maybe climate change in the future of the planet. And yet, in looking at a set of 25 sustainable dietary guidelines that we collected from the United States and Europe, we only saw biodiversity mentioned 3 times, whereas buy local was invoked 14 times. And yet industrial meat, because of the kind of monoculture of it in terms of the species that are produced in concentrated production systems and the limited types of grain-fed diets that they give, reduces both animal and crop diversity and overall biodiversity as a result. And it's not the same as the traditional types of herding and animal husbandry that have gone on for millennia, inside, not in a concentrated way, but as part of broader farming systems. Next. The second thing I want to focus on is the well-being of animals. Again, this is a question of animal welfare and animal rights. Okay, with animal welfare, the treatment of animals in CAFOs gets talked about, but it gets marginalized, and especially the fact that about 97% of our meat comes from concentrated animal production in this country. It's an important question, and the curiosity of it is the fact that if we treated our pets the way these animals are treated, we'd all be thrown in jail. And yet the anthropocentric approach that we take is that it's okay to treat animals this way and to produce them by the billions as an ecosystem service to serve ourselves. And the question is, do animals have integral rights so as not to be treated this way? An important part of that element is the fact that we're so distant now from where food comes from and how it's produced. The only place we see meat now is in the grocery store, and the only place perhaps we see these animals is on the television. Next. Another dynamic of the sociocultural elements of sustainability and meat-centered diets is that when meat is at the center of our meal, of our plate, plant-based foods are increasingly processed and marginalized, as Walt was discussing a little earlier. It also promotes overeating with this kind of large, fleshocentric approach. Food waste increases. In fact, meat is the most wasted of all of the food categories. It produces the most waste, not only in its production but also in terms of the plate and in terms of serving sizes. And beyond that is the issue of McDonaldization, it's called, that George Richard coined a couple of decades ago. And this is the fact that these types of high-meat Western diets are spreading around the world, and with it the types of obesity and growth in chronic diseases. I can't see the rest of the slide. Can we scroll down a bit or not go to the next slide?
Sorry about that.
Okay. Are you trying to recalibrate, David?
On my screen, it's showing. You're not seeing that, huh?
No, but if you want, and I'm not seeing the slides. I can go to mine if you want and just go through it. Let me try that.
Yes, please.
I apologize to this. Okay. The next slide would be consumers as citizen eaters. Sustainable dimensions of industrial meat. Are you there?
Yes, I'm just having a little glitch here. So I wonder if you could just talk off your slide.
Yeah, I'll talk through it and see if you can catch up. Okay, so the question becomes around these environmental questions and these diet and health questions is how to link all of these together into a broader spectrum or scale of public health concerns. How can we invoke more focus on global food security, on biodiversity, and on environmental issues in general, along with the types of health questions that pervade the debate right now about how much meat we should or shouldn't eat? And how can we be bringing in questions about animal welfare and animal rights into a broader sustainable network? Are you still lost there, and is it still glitched? All right, I'll keep going.
Yes,
Pardon?
Yes, please.
Okay, what I'm trying to make the case is that we can only do this with a systems approach in which we embed any single dimension of sustainability and public health, ecological, nutrition into a broader kind of scale which covers the landscape of different issues and embeds those in the next scale around the broad global issues of sustainability in general, of which the food is a critical part, an important part, but not the only part, and it cannot be addressed in and of itself without addressing broader issues about ecology and economy. Systems approaches means that decisions about meat consumption need to be incorporated into broader debates about sustainability and public health. Systems approaches are best suited to tackle these dynamics, but they're really quite complex. And the question is, how do we build systems approaches and invoke these much more diverse and complex dynamics or questions into a discussion without kind of losing the audience? In my next to last slide, is that available to see? If not, it's a slide from England called the Global Food System.
Thank you. We're trying to bring it up.
Okay. Well, I'm just about done. I want to finish up. If you can bring that up after the fact, that's fine. But it's this extremely complex diagram that was made of the global food system, and it's a wonderful diagram, but only the people who made it and a few people who can get it up on a large wall and look at it are really going to be able to appreciate all the connections and the components and the linkages and so on and so forth. And that invokes the question of how, or is it wise to try and bring together all these many issues, all of which are linked together in some way or another, but are still somewhat distinct, and throw those out there, or do we want to try to keep the message concise and distinct and hope that people change? My vote is more in favor of the more information people have, the merrier. The more reasons people have not to eat meat, the more rationale and the more movement we can have in trying to change a food system that is primarily dependent on highly concentrated production of meat and a growing tendency throughout the world at great risk to the ecology to do so. So I throw that out for discussion and leave it at there, but I also want to say that it's not an easy answer. And I'll finish with that.
Well, thank you, Hugh, and my apologies for the glitch in the video. I'll try to pull up this global slide if I can. So I hope those in the audience have been sending in questions through the chat function. And now, I'm going to
Sorry, we have some feedback. I'm going to go ahead and start reading some of the questions that have come in from the audience. I've got one here specifically for Roni. I'll unmute all of the speakers now. Roni, wouldn't the most sellable way to promote health and reduce meat consumption be to develop plant-based substitutes that look and taste like meat?
That's an excellent question, and there are certainly some plant-based substitutes that look more like meat than others, and studies have found that especially for meat eaters, they're much more receptive to those, whereas those who are more like vegetarians don't really care if their meat substitutes look like meat. And I'm not sure if the person was referring more specifically to laboratory-produced meats that aren't, raised directly from animals. And those, at the moment, still have questions about the sustainability of producing those as well because of the high amount of energy that goes into them and the very high cost of producing them. And there have been some studies in terms of people's willingness to eat them and that kind of yuck factor that some people have related to them. And so that's still an area for research.
Great, thanks, Roni. We've got another question here more on the policy side. And Eleanor Boyle asks, how can citizens help pressure governments to include sustainability in dietary guidelines? Should we who work in this area consider a campaign, postcards to Washington with a message such as, my health depends on this?
I can take that one as well, maybe others want to join in. So I think that for this round, it's a little bit tricky because they've moved so far along in the process that I'm not sure. There have been these public comment periods, and those are great times to weigh in, and that will come up again in a couple of years when they do this the next time. But I'm not sure that there's that there's a lot of need for that at this point, although in terms of that little piece that I showed you from the House Agriculture Committee, maybe there might be a way to organize politically if that should come into play to try and overturn that.
This is Hugh. I would also encourage, given that the slowness of the federal government and the politicization of the process, there's more and more focus now on promoting political change at the local and state and regional levels, and organizations tend to organize and act more effectively at that level. And increasingly, when we have these food organizations and municipally based food positions and so on, there's an opportunity to put in, whether it's through legislative or non-legislative mechanisms, efforts to promote sustainable diets within the regions where people are operating. So I think go local in this case might be a good approach.
Yeah, can I just add to that? Oh.
Go ahead.
Yeah, I just want to briefly add to that, and one example of that is that there are campaigns going on in school districts and things like that for programs such as Meatless Monday, which would achieve a lot of these goals, and so joining on to some of those types of campaigns.
This is Walter. It's just to, I guess, not second but third, that it is apparent that most progress in public health areas is being made at this local and state level. That, for example, anti-smoking efforts in public places has really been entirely at local levels. There's no real national legislation on this, and essentially the reduction in trans fat has been really almost entirely initiated at state and city level, and eventually it gets translated into national policy, but that's usually after a lot has been done locally, and many other environmental things have really been led at that level as well. But it's unpredictable. Sometimes someone will really take an initiative at the national level and assume leadership in an area. We actually had that happen in trans fat labeling, and one individual actually, after years of lobbying to see action on that, somebody finally stood up and pushed that forward. So we need to provide support because they'll get attacked when it does happen. But I think the real work I think can be done wherever you are, at your school, at your work site, at your community organizations, and beginning there is actually a very effective way to get started.
Thanks, Walt. I've got a couple questions here coming in from a few different attendees here about the difference between consuming conventional beef versus grass-fed beef, which has less total fat, more omega-3s, antioxidants. So just what about the pushback from industrial meat industry to recommendations that we eat less meat? Are there any conversations going on about raising more ethical, sustainable meat and changing the price structure to make it financially sustainable?
Yeah, I'll try to start off with that. And that is an interesting question that arises frequently. There are some differences in the composition of grass-fed meat versus industrial-raised, mostly grain-fed animals. As you mentioned, the fat content is usually lower in the grass-fed animals just because they're walking around and getting some exercise. But in terms of health effect, it's not at all clear that the adverse health effects are from the fat part of the of red meat. I think there's quite a bit of evidence that large amounts of heme iron are contributing some of that. That for cardiovascular disease, the cholesterol is actually mainly in the non-fat part of the meat, so the leaner meats actually will have more heme iron and more cholesterol in them and aren't necessarily better for us. There are some more omega-3 fatty acids in the grass-fed beef, but there's lots of other ways and more important ways to get omega-3 fatty acids. So I think it's not apparent that the health differences are very important, and the main point from a health standpoint would be to reduce consumption of red meat. Now, if we look in the big picture, if we only had grass-fed beef, it would solve a lot of the problems because the production would be much lower, the price would be much higher, which I think would be good. And ideally, I think the red meat will be part of our food supply, I think, in the foreseeable future. But if it was only grass-fed beef, we would probably treat it more like we treat lobster, which I really like, and have it a few times a year, but definitely not as a monthly or a daily food or even a weekly food. It would be, if you really like it, it's something that, again, like the traditional Mediterranean diet, we could consume in a few times a year on special occasions. It would be expensive, but that cost would really reflect the price of production and consuming meat. The environmental footprint is very big, even for grass-fed beef.
Right. I want to concur with that, Walt. The footprint question is a good one. If meat was not produced in these confined animal operations, but on a grass-fed basis, it would, in some respects, be much better for the environment. But on the other hand, the greenhouse gas footprint of animals, of beef, cattle, raised either grass-fed or on lot for part of their lives isn't really that much different. And the biggest impact one can have is by just producing and consuming less meat in total. And eating better meat would be an obviously attractive trade-off.
I concur with both of those.
Great. We've got a couple questions in here where people were asking about the difference between conventional beef and grass-fed beef, but then also people bringing up questions about chicken, lamb, duck, meat that might not be considered necessarily red meat, and how does that kind of fit into this equation about sustainability and health?
Yeah, maybe I'll start off with the health impact side. That it is interesting that consumption of poultry seems to be, as I showed in those slides, advantageous from a health standpoint, whether we're looking at cancer or cardiovascular disease or diabetes or total mortality. Part of that is that the fatty acid composition of poultry is actually quite a bit better than for red meat, but I think there are probably other aspects as well that are responsible for that. So I think there's room in the food supply for poultry consumption for if people do want to consume meat. Having moderate amounts of that can be very compatible with a healthy diet. And the same with fish. And fish is a very interesting topic because we can't really produce more fish or from wild natural production. That we're already overfishing. We're pretty much maxed out there. So the additional, if we're going to recommend fish consumption, it has to come from some form of aquaculture. And actually some forms of aquaculture can be very environmentally sustainable. That the conversion of feed to fish is very efficient. And with research being done to optimize that, it's impressive how efficient the conversion of feed to fish can be, partly because the fish are cold-blooded and they don't need to maintain a body temperature. So finding ways to produce fish, and also I think poultry, in the most efficient and environmentally sensitive ways is actually a good research investment, as Roni pointed out. For healthier foods, we really need to, I think, invest in ways to produce these efficiently and environmentally sustainable ways, and then they can be part of a food supply.
And I would just add, from an environmental standpoint, some of these, something like poultry, the footprint on most of these factors is far lower than the red meat, and yet there's also a lot of challenges with it in terms of the way that it affects water and soil, the animal welfare, the challenges for workers and producers, and so so right now we're generally not producing our poultry in a way that is environmentally sustainable, even if it's not quite as bad as the beef. In terms of fish, I think those issues were covered. And in terms of lamb, I would just say that those actually, some studies have found lamb to have even a worse footprint than beef in terms of greenhouse gas emissions.
Great, thanks so much. I think we're nearing the end of our time here.
You know what, Rachel? I think if we have some questions, and I think, and if the panelists are willing, we can stay on it for a few minutes longer. I wanted to give Hugh a chance to discuss the final slides that we missed from his presentation. And then I can wrap up. And if there are other questions, go ahead and take one or two more after that.
All right, I'll just throw in for 30 seconds because I've kind of mentioned that, but if you wanted to really do a systems-based graphic of as many elements of the global food supply chain and related other cultural, social, and ecological influences, this might be one way to look at it. But again, it's a very difficult to see on the screen. You have to blow it up several times. And on top of that, you make these connections, and what they've done admirably is a job with using different colors and arrows and thicknesses and so on that then go along with a script to help explain what these connections are. And so you go from systems knowledge to kind of a systems thinking approach where you explain how these relationships all work together. But again, that invokes that question, who is this for, and how can we use these types of modeling to help better understand all the connections that influence any part of the food system, including the meat supply and all the dynamics involved, and then come to some policy-related applications of this that will resonate not only with policymakers but with the public at large.
Great. Thank you.
I've got one last question here, specifically about health professionals talking to their patients about these issues. And Marcia asks, given that many researchers are recommending higher protein intake for the purpose of weight management, how would we assure or advise patients to meet these higher protein intakes while also promoting a non-meat diet?
Maybe I'll try to respond to that. First of all, the evidence that high protein intake per se is effective in controlling weight is not at all clear. In fact, it may also depend on the protein source. We have looked at this and published in the New England Journal a couple of years ago looking at specific foods in relation to long-term weight control, and high red meat consumption was related quite clearly to more weight gain, not less weight gain. So that's not a good way to go in terms of long-term weight control. I think part of this focus on protein has come about from recognition that high carbohydrate, especially high refined carbohydrates and sugar, are related adversely to weight gain. But I think there are definitely ways to reduce that glycemic load, the high refined starches and sugar, without consuming a lot of red meat and animal proteins in general. And that partly can be by emphasizing more plant proteins. Definitely higher nut consumption has been related to less weight gain because of the high satiety of nuts. And also there's quite a wide variety of plant proteins, but healthier forms of fat in the diet. Obviously, again, traditional Mediterranean diet was a relatively high-fat diet, and that is a dietary pattern that has been effective in long-term weight control. So this sort of paleo diet actually is not a good way to go either from a health standpoint or certainly not from an environmentally sustainable standpoint.
This is Hugh. Walt, can I ask you a follow-up question on that? With regards to aquaculture and fish, I remember, ages back when I was over there doing my dissertation, David Hunter had produced a paper with many of you showing that consumption of basically white meat fish didn't have much of a correlation with health outcomes. And the question becomes, is the consumption of basically white fish, i.e. those not very high in omega-3s, a worthwhile objective other than for the pleasures or cultural satisfactions that people get from having fish in their diet?
Well, I think that's a good point, that the uniqueness of fish mostly comes from the omega-3 fatty acids, and there are multiple ways of getting omega-3 fatty acids, including from plant sources as well. But even the white fish meat does have some omega-3 fatty acids, and so in some places, and particularly we're seeing in China, that they do contribute to omega-3 fatty acid standpoint, where other sources of omega-3s can be relatively low. So some of this again, it all depends on what you're comparing. Say the fish to, if it's a replacement for red meat, that can be a very good step in the right direction, even if it's from a white fish, lower fat type of fish. But apart from the omega-3 fatty acids, there's not a unique health advantage from what we can see. It is interesting, again, that in many places now, the feed-to-fish conversion has become very efficient. China's done a lot of the leading work in this, and a lot of this production is fairly local, and using fish ponds and essentially recycling a lot of plant material into fish has probably been of great nutritional benefit to the Chinese population, where other sources of protein were fairly limited.
Thank you.
Well, thank you, presenters, and thanks for your patience in going over a little bit longer, and to our audience members as well. Just a few wrap-up comments. For the participants, you're automatically registered for this last Meat Matters webinar on January 8th, which is with infectious disease doctor Marty Blazer, who's talking about his book, Missing Microbes, and where we're going to be looking at the links between our microbiome, the epidemic of obesity, and gut health in general. So don't miss that. The other speaker for that webinar is going to be Dr. Lance Price, a microbiologist who's going to be linking some of those concepts around the microbiome back to meat production, and specifically antibiotic use, which is integral to a lot of modern meat production. Later in 2015, we're also going to have more webinars with authors of books. And Walt, I don't know if you have one coming out, but we're going to talk with Daphne Miller on pharmacology, Chef Dan Barber on his new book called The Third Plate, as well as Dr. Mark Heyman talking about gut resilience. Audience, if you've missed previous webinars in this series or you want to refer friends to them, just let them know that they can register for the series and then access the archive broadcasts on our website. At healthyfoodaction.org, you can find more resources on the topics that we focus on, like preventing obesity, food pollution, and saving antibiotics. So for now, thank you all and happy holidays. We look forward to seeing you on January 8th.